Good afternoon, everyone. I am Nancy Polsinelli, Interim CAO for the Region of Peel. I'm joined today by Jessica Hopkins, our Region's Medical Officer of Health, and the mayors of our partner municipalities, Mayor Bonnie Crombie, City of Mississauga, Mayor Alan Thompson, Town of Caledon, and Councillor Fortini, acting on behalf of Mayor Patrick Brown as acting mayor. We're here to share information about COVID-19. We want the community to know that the region and its partners are working together to support and protect the health of the people within our region, more than 1.4 million people. The region is ensuring we are positioned to respond to the potential for transmission within our community. Yesterday, we informed Council that we have fully activated the Regional Emergency Operations Center. This does not mean that the Region of Peel has declared a state of emergency. We have not. This is about focusing resources effectively in both mitigating the transmission of COVID-19 while operating the services that people depend on. To do this, we are working very closely with the region and its partner communities, led by the mayors with us today. Dr. Hopkins will now provide an update on the status of COVID-19 in our community. Dr. Hopkins?
Thank you. Good afternoon. With the announcement of the COVID-19 pandemic by the World Health Organization, increasing cases in Ontario, particularly related to travel, and unprecedented measures to protect the health of Ontarians, at this time, Peel Public Health is recommending additional preventive public health measures to reduce the spread in the community. In consultation with local healthcare institutions and education leaders, Peel Public Health is recommending the closure of child care centers, before and after school programs, and March break camps effective March 14th through April 5th, coinciding with the school closure dates. The Chief Medical Officer of Health for Ontario has recommended the immediate suspension of all large events and public gatherings of over 250 people. For events and public gatherings less than 250 people, Peel Public Health is directing organizers to assess the risk. Further guidance is available on our website. The Chief Medical Officer of Health for Ontario is further advising residents to avoid all non-essential travel outside of Canada. In addition, Peel Public Health is recommending anyone that has traveled anywhere outside of Canada to self-monitor for symptoms including fever, cough, and difficulty breathing, and avoid attending locations where it is difficult to distance yourself from others, such as schools, workplaces, and mass gatherings, for 14 days after returning to Canada. At this time, this means that for those traveling for March break and hoping to attend school or work on April 6th in Peel, you should return to Canada by March 23rd. Anyone who has traveled outside of Canada and experiences symptoms should self-isolate until they have been free of symptoms for a full 24 hours. Our emergency departments and assessment centers are currently very busy, so I'd like to reiterate the advice to the community. If you have no symptoms of respiratory illness and have not been given different direction by public health, you do not need to call public health and you should not seek testing for COVID-19. If you have mild symptoms of respiratory illness for which you would not normally seek medical care, please stay home until you've been symptom-free for at least 24 hours. It's important for workers to follow the direction of their employer's occupational health and safety, and this is especially true for our healthcare workers. If you have moderate to severe symptoms of respiratory illness and require medical care, please make sure that your healthcare provider is aware that you have traveled to an affected area or been in close contact with someone with COVID-19 so that they can take appropriate infection prevention and control precautions. There are currently 6 cases of COVID-19 in Peel. All of the Peel cases traveled to affected areas or had close contact with a case of COVID-19, and all are in self-isolation and recovering at home. The risk in Peel continues to remain low, and there are no known cases of community transmission in Peel. These recommendations are being made to further enhance prevention measures to keep our community safe and healthy. Thank you, and I'll turn it over to Mayor Bonnie Crombie.
Thank you, Dr. Hopkins, and thank you, Nancy. As I'm sure you can all appreciate, this is a rapidly evolving situation, and in the past 48 hours, the landscape here at home and across the world has changed drastically, and cases across the province have risen dramatically. Peel Public Health and our partners in healthcare, Trillium Healthcare, have been working around the clock to treat and reduce the further spread of COVID-19 in our community. And I want to thank them for their efforts because this is not an easy job. As elected officials and public health experts, it's our duty to act in the best interests of the people that we serve. And that means making decisions proactively to protect the health and the safety of our residents. Health is everything. Without it, nothing else matters. I ask residents to please remain calm. The directive by our medical officer of health to cancel March break camps and close before and after school care and daycare centers is the right decision. I understand that this will have an impact on families. We are asking that employers please be patient and understanding as parents and families work to arrange care for their children. Many businesses will have already established work from home policies, as has the City of Mississauga. In addition to today's announcement by Dr. Hopkins, Mississauga will be taking additional measures to protect our residents. The City of Mississauga has made the decision to close all city recreation, library, and cultural facilities to the public effective tomorrow, Saturday, March 14th, for 3 weeks until April 5th. At this time, City Hall will remain open. We are working to communicate these closures to our staff and are working on to minimize impacts to ensure fair compensation. MyWay Transit will remain fully operational. Our buses are still safe to ride. There will be no changes to service levels at this time. We will continue to enhance microbial cleaning. We ask residents for their patience and their understanding. Your health is of utmost importance, and I cannot stress this enough. Please practice social distancing. Avoid large social events and any non-essential travel. That includes, unfortunately, your March break plans. As Dr. Hopkins mentioned, these are precautionary measures and the risk to the public remains low. Peel Public Health will continue to provide updates at peelregion.ca/coronavirus. For information about the City of Mississauga's facility closures, visit mississauga.ca/coronavirus. If you have health concerns, contact Peel Public Health at 905-799-7700. We will rise to the challenge as a city, as a province, and as a nation to overcome this. Please be kind and think of others. The young, the elderly, the pregnant woman, and those with compromised immune systems. We've seen the compassion and the kindness in others in times of need. I know that you will all come together to flatten the curve and keep our community happy, healthy, and our economy running. Thank you very much, and over to Mayor of Caledon, Alan Thompson.
Thank you, Mayor Crombie. And like Mississauga, Caledon has followed the advice of Dr. Hopkins. We have closed all our facilities for recreation and library, and our town hall will remain open, and we're there to serve our community the best way we know how. There'll be some staff that will be working from home as needed. I encourage everybody to remain calm. We all need to be responsible. We need to be diligent. There's no time for panic. What we need to do is be very careful, avoid places as high populated areas, in dense areas. We need to really respect our seniors to keep them health and safety, as well as pregnant women, as well as people that are very susceptible, that have been recovering from illnesses like cancer. We need to protect our community, keep it safe. And that's the responsibility that I think on behalf of all councils is to keep our community safe, but we can't do it alone. We need the public to be part of that. So we're asking everybody to be extremely diligent. Please keep your hands clean. There's lots of opportunity for that, but we're asking everybody to follow the advice that is going to be constantly coming out from Dr. Hopkins and municipal staff from all municipalities. And you've heard the same number, 905-799-7700. If there's any issue that you might have, reach out to Public Health. That's where you should be. Do not be going to your family doctor. Check with Public Health first. Thank you. I will now turn it over to Councillor Fontini, the Acting Mayor of Brampton.
Thank you and good morning. Good afternoon, sorry. So on behalf of Patrick Brown and the City Council, we're also following the same steps for safety of our residents. So all our recreation center camps through March 16th till April 5th will be closed, and this other changes will come. Our committees, City Hall will also be closed. Most of our staff will be working from home. Our fire, transit, and emergency will be on schedule as today, unless other changes come forward. And unless other changes come on the 5th, until now, everything will be closed, and we're going to follow the same footsteps as our Region of Peel in Mississauga is doing. So thank you.
So on that note, I know Dr. Hopkins as well as the mayors are well open. We are open for questions, if you have any questions.
Hi, this is Karen Martin Robbins from the Caledon Enterprise.
Hi there.
Hi, I had a question for Dr. Hopkins. You had mentioned that as of today there were 6 cases, confirmed cases, in Peel. According to the Ontario Public Health, there's now 10. Is that number not correct?
So when we pull the numbers, we always take them at a specific time. So when I did the last pull and updated my speaking notes, it was
Sure,
6.
yeah.
But they're being updated. So the ministry is updating twice a daily, and then public health is following with those as well.
Okay.
Hey, Steve Cornell here from the Mississauga News. Can I ask a question?
Certainly.
Go ahead.
Question for Mayor Crombie and perhaps for Dr. Hopkins as well. We've said kind of as social distancing practice kind of takes over here, that folks should stay away from work or other kind of crowded places if they do feel they have symptoms of COVID-19. How concerned are you that folks may kind of take just take a risk knowing they can't necessarily miss a paycheck, or are concerned about the consequences of not showing up to work?
That's a very good question, Steve. So we are encouraging people, all of our residents, to work from home as they can. Certainly, there are many people who are self-employed in the city of Mississauga. I know most of our large companies, we have 98,000 businesses, 1,400 multinationals, 75 Fortune 500s. Many of them have given using the same protocols as issued by Peel Public Health. And certainly we are encouraging people to use their discretion and not to attend large gatherings. I know myself, I believe Mayor Thompson, certainly Mayor Brown, and others have reduced the number of public events we will be attending. We are not shaking hands, etc. And I'm quite certain that most employers in the region of Peel have taken the advice of Peel Public Health and are encouraging their employees to do the same.
Perhaps I'll just add to Mayor Crombie's comments. So when you look at the workplace, yes, of course, we want to pay attention to the significance this could have in terms of an economic impact. When your employees are healthy, they're able to work. And so for those that have opportunities to have alternate work arrangements or work from home or do social distancing within the workplace, we encourage that, because if your employee's sick, they can't work at that time. So we're really focused on trying to keep people healthy. Are there any other questions on the phone line?
Okay, wrap it up.
Oh, sorry, I thought you were going to
Yes, go ahead.
Okay, sorry. All right, so if there are no further questions, I want to thank everyone for joining us today. And thank you to Dr. Hopkins and the mayors and Councillor Fontini on behalf of Mayor Brown. Thank you.